I'm extremely delighted that, in Tamil Nadu, which had the second oldest eye hospital in the world, the Government Regional Institute of Ophthalmology, we have such expertise, especially in the eye. We are very conscious of the fact that there has to be a very effective public-private partnership. That is why most of the experts and the expertise and the hospitals are located in Tamil Nadu, whether be it individual hospitals like Agarwal Hospital or the other established centers, both Arvind Eye Hospital or Shankar Nethralaya, for that matter Rajan Eye Hospital. Every eye hospital which you name it, they have the expertise. But the challenge which we are facing now is that we started these programs on eye as early as 1976. We have a national program. The Government of Tamil Nadu also very actively collaborates with that was the first instance. Even now, though we talk of CM Health Insurance now, but perhaps eye was one area which was the first area where we had a very active NGO government or public-private partnership. Our goal still has been that to bring the level of blindness from 1.4 to 0.3 by 2020. That's the challenge. And even though today's particular event is more focused on retinal surgery, it's my duty to say that still we have challenges on cataract. We have 62% cataract, refractory error still are 19.7%, corneal blindness 0.9%, glaucoma, which again is an emerging challenge, which generally, the government, the focus is on the, earlier focus used to be only on cataract surgery, but now their focus has changed to also give thrust on the glaucoma, treatment of glaucoma 5.8%, surgical complications. Even now, eye being such a sensitive organ, we have these complications around 1%, and posterior capsular opacification or the other diseases. The other, when you come to retina per se, I am sure that each one of you would be gaining, this being a very sensitive kind of place, you need the skill and the expertise. That is where I think this retinal conference and the kind of lectures and the live demonstrations which you have and the individual successes which just like our friend from Poland has come and is sharing, it really offers you a lot of opportunities. Because eye is one area, suddenly you lose an eyesight. What do you do? Retinal detachment or age-related macular degradation or any other retinal challenges. How do you do? So there I think this kind of conferences offers an excellent opportunity for everybody to share each one's success. I have just seen the kind of, in WhatsApp, the photos, the kind of successes he has been doing. In Tamil Nadu, the other newly emerging challenge is that we have been saving neonatal children. So ROP, retinopathy of prematurity, which otherwise, in states like UP, Bihar and all where premature babies are still yet to be entirely saved. We have that low body weight, early birth children. There again we have to have the expertise. So these are some of the newer areas. I am sure with such experts sharing knowledge, you all will be able to help the government and help the public at large to tackle all these eye-related issues. Eye being a sensitive thing, giving an eyesight and getting an eyesight, something really very beautiful kind of thing. And being such a sensitive organ, a small mistake could lead to, including on the infection control things, we would need a lot of expertise and the latest kind of technologies which you have developed of preventing rejection of cornea. Those things are all which are very useful. This being focused on retina, I am sure all of us, just like each of your earlier sessions, this year's session also would be very valuable for all those who have assembled here. You will go back richer with greater skills. Thank you one and all for giving us this wonderful opportunity to be.